Tonight, the CDC says the Cyclospora outbreak is now confirmed in 9 states.
While Florida and Georgia are not included, the products tied to the recall were actually distributed here, and the CDC says both states have dozens of cases.
So tonight, Biljana Garland joins us live in the studio, and she spoke to a doctor who confirms that, yes, we have seen cases on the First Coast.
Yes, there have been. I spoke with a doctor from Baptist Health, and she says there have been 4 cases in Duval County and 4 in St. Johns County. The CDC reports both Florida and Georgia have been between 31 and 80 cases each.
Take precautions, not panic, and just be aware of what you eat and how you prepare it.
Dr. Shalika Katugaha with Baptist Health says the biggest concern with Cyclospora outbreak is shredded and iceberg lettuce. She says your best bet is to avoid any lettuce brands that are on the FDA's recall list. The FDA urges people not to eat recalled iceberg lettuce from Taylor Farms, a supplier to Taco Bell. Despite a false positive test, investigators say the voluntary recall is necessary because they traced illnesses in Taco Bell's supply chain back to Taylor Farms. Taco Bell confirmed in a statement it has removed lettuce from their ingredients. Dr. Katugaha says you can still eat lettuce if you prepare it properly.
It requires a lot of caution because, Cyclospora can stay despite washing it.
She says you can brush the lettuce thoroughly to remove the parasite, but she says the best way is to cook it. She says people do have a misconception.
So you can't get it from other people or from whoever cooks your food.
She says the symptoms of Cyclospora are similar to food poisoning: explosive, watery diarrhea, fatigue, and nausea. But she says Cyclospora will not show up immediately after eating contaminated food. It will show up about a week later.
It'll wax and wane and go on for weeks to months. And you'll have this relapsing diarrhea that goes away and then comes back and goes away and comes back.
She says if you test positive, you need to get treatment, which is an antibiotic, for a week. Dr. Katugaha says Cyclospora is seasonal, which with May through August being the peak. She says to make sure you follow the guidelines for the CDC and FDA.